how would you explain what psychedelic assisted psychotherapy is in comparison to your traditional styles of therapy?
All right, so I think the key in the term psychedelic assisted therapy is actually that middle word. It's actually the fact that it's assisted therapy. Okay, now psychedelics are super exciting. There are studies all over the world, specifically, the MAPS trials occurring over in the US are seeing wonderfully profound results in terms of the use of psychedelics, all types of psychedelics. But how this differs is that we are just utilizing a psychedelic component to assist a therapy program, which may help patients find breakthrough. And that's the way I see it, is that the magic is not entirely in the substance. The magic is in the therapy, and the combination of the two works synergistically and exponentially even. So patients that have found to be treatment resistant, so that's patients that have been on multiple different antidepressants over a certain course of certain years, and they've sort of hit a wall in their therapy where they feel that it's no longer having any benefit. We start wondering whether they're becoming treatment resistant. And this is where a substance like a psychedelic can really have profound effects.
Hey everyone, on the show with me today is Dr. Kris Goodwin. Dr. Goodwin is an anaesthetist by trade, but he's on the show today because he has a very unique area of expertise. He has a practice called Intrinsic Pathways, and at Intrinsic Pathways, they help individuals struggling with mental health issues such as depression, anxiety, post-traumatic stress disorder, and chronic pain through psychedelic-assisted psychotherapy. Yes, psychedelic-assisted psychotherapy. Through the administering of ketamine, they have had tremendous results in improving people's mental health and well-being, and the psychedelic space is really one of the most promising and exciting spaces in the medical sciences world at the moment when it comes to mental health breakthroughs. This is a fantastic episode, and if anybody is struggling with mental health and has had mental health issues in the past, this is certainly something that you can listen to open your mind as to what is available out there. Please check out Dr. Kris Goodwin and Intrinsic Pathways on the below links. And if you like this episode, do me a favor, share it. Lastly, nothing in this episode is a diagnosis, and if you are thinking that this might be a route that you should go down, you need to please consult your specialist or your doctor before moving forward, and doing so in the right way, in the safe way, through a medical professional, through a licensed practitioner who can administer these therapies safely and successfully and legally. Thank you. That is it. Enjoy. Chat to you next time. Dr. Kris Goodwin, welcome to the Expect Performance podcast, all the way from Joburg. Lovely to have you.
Thank you. Thank you for inviting me. This is very exciting. Love to be able to share what I'm passionate about and ways that I feel is the future in terms of mental health.
Kris, how would you explain what you do for a living to somebody that you just met?
Okay, so me personally, I do quite a lot of things. I call myself a GP anaesthetist. So that entails a lot of things. Firstly, I have a background in anesthetics, so I work primarily in the hospitals, putting patients to sleep for certain operations. That's my bread and butter. In the last number of years, I have found quite a niche and quite an exciting sort of interest in psychedelics. And it's really great because it somewhat overlaps with my anesthetic background. So mental health has always been something that I have been very passionate about. I've had my own mental health journey, so it's something that I can relate with a lot of people about. And the psychedelic that, or in terms of psychedelic medicine that we talk about here in South Africa, the modality that we use is an anesthetic agent. So I have a lot of experience already working with that specific drug. These days it's call it medicine, call it drug. Um, Point is that it's something that can be utilized in a very helpful way for many people, and people wouldn't have even thought about it. So I also have a small clinic where I practice psychedelic medicine and I do ketamine infusions for patients. And we run a ketamine assisted psychotherapy program at the center that I work at, where I put together a program for patients over a course of 3 to 6 weeks. And we run infusions for these patients of ketamine at sub-anesthetic doses. And this has a psychedelic type of experience for the patients and has profound effects on their mental health. Partnered with a a really good psychotherapy plan, this can be very helpful in terms of patients that are struggling with things like depression, anxiety, PTSD. The list goes on. So, I dabble here and there, but this has been a very growing interest of mine over the last number of years. And the way I see it, I think that it's the future of mental health. And I'm excited to be one of the first in South Africa, at least, to get on board with this kind of program and to be at least a little bit more open-minded and open thinking about how we can utilize this going forward.
Yeah, that's very interesting, Kris. There's no doubt that it's getting some more traction both globally and now, as a result, case in point, with Intrinsic Pathways locally. How would you explain what psychedelic assisted psychotherapy is in comparison to your traditional styles of therapy?
All right, so I think the key in the term psychedelic assisted therapy is actually that middle word. It's actually the fact that it's assisted therapy. Okay. Now, psychedelics are super exciting. There are studies all over the world, specifically, the MAPS trials occurring over in the US are seeing wonderfully profound results in terms of the use of psychedelics, all types of psychedelics. But how this differs is that we are just utilizing a psychedelic component to assist a therapy program, which may help patients find breakthrough. And that's the way I see it, is that the magic is not entirely in the substance. The magic is in the therapy, and the combination of the two works synergistically and exponentially even. So patients that have found to be treatment resistant, so that's patients that have been on multiple different antidepressants over a certain course of a certain years, and they've sort of hit a wall in their therapy where they feel that it's no longer having any benefit. We start wondering whether they're becoming treatment resistant. And this is where a substance like a psychedelic can really have profound effects. So even these patients that are struggling with this treatment resistance can find a little bit of hope somewhere. So where, just to explain the process a little bit is, it's important that if the patient is willing and open to the psychotherapy component, we won't administer any ketamine, any psychedelic, without there being a psychotherapist involved, and preferably a psychiatrist as well. We're a multidiscipline team where we have certain components that have to be put in place for the entirety of the journey. And the process needs to be respected on all fronts. So the patient must be sort of willing to open up in terms of a psychotherapy component. And where my job comes in is facilitating the ketamine infusion safely. And we find that when the patients go for therapy, within 72 hours of their infusion, they seem to be much more relaxed about the therapy. They seem to be more focused on their goals. They seem to be just more able to get in touch with their emotions and their intentions when it comes to that therapy component in addressing core aspects of what's troubling them. So this is where the difference comes in.
Wow, that's fascinating, man. But how does substances like ketamine work in the brain to help patients with their depression, anxiety, post-traumatic stress, etc.? What is the mechanism behind it?
Okay, so ketamine specifically, it is an NMDA antagonist. Essentially, what that means is that it blocks a certain neurotransmitter in the brain called glutamate from binding to that receptor. And just a bit of neurochemistry here is that when those receptors are blocked, you sort of have a surge of this glutamate on the brain. Now, glutamate is the excitatory neurotransmitter in the brain. Okay, so that's what promotes wakefulness. That's what promotes sort of that energy on the brain of staying up late and getting all excited. When you have this surge of glutamate, your brain tries to compensate with another neurotransmitter called GABA. Now, GABA is essentially that relaxing neurotransmitter. Okay, so now you have this balance between these two neurotransmitters trying to take place, and your brain's trying to find some sort of middle ground here and there. Now, with this surge of glutamate, this is what causes that I want to say heightened awareness within your brain that is partnered with the psychedelic experience. But with this process also comes a heightened neuroplasticity. Okay. Bottom line, what that means is that your brain has a more potential of change. There's a little window of opportunity here where your brain is willing to make certain changes. And it does this by growing new neural pathways. So your brain is structurally changing during this time. Okay. There's more interconnectedness between different parts of your brain. And as I said, this creates a window of opportunity essentially for learning. So what we're trying to do here, and this is just in layman's terms, is just to say, well, I have this window of opportunity to sort of get my mind together. With the help of psychotherapy, I may be able to learn better skills to help cope with my emotions. This is essentially now how we teach these new neural pathways, new skills, and to get out of the old default mode patterns. All right. So if a patient had to be tremendously depressed, say borderline suicidal, and they have been for a number of years, they have a default mode network. We call it the DMN. And the DMN is almost like your baseline state when you're sitting by yourself in a quiet room with no other external factors bothering you. Where does your mind and where does your brain go to? Okay, how does your brain work during that state when it has no distractions? And for some patients that are heavily depressed, their brain obviously goes into, and their thought processes go into a very dark space. And we have an opportunity to kind of start detaching those default neural pathways and to teach them something a little different, but it's a whole process. The magic doesn't happen in one session. It doesn't happen during the infusion itself or during the psychedelic experience. The psychedelic experience, I mean, in the beginning, it can be quite frightening, but once you learn to trust it, it's almost like a pleasant side effect, if you want to say so. If you learn to kind of feel comfortable and safe within that space and within that part of your mind. But the true work comes in the time afterwards, where you have this increased neuroplasticity and this increased potential for learning and this increased potential for getting to a different emotional state. So, it's this combination of the neurotransmitters, the neuroplasticity, the neural pathways. It's all about that kind of component that really does the magic, as opposed to the psychedelic hallucination and experience itself. Sometimes a lot of the time we'll find that a patient will connect a lot of their experience, their hallucinations and their psychedelic experience with past trauma. And that's very normal. But it also opens up a space of bringing this to the surface and starting to feel more comfortable with addressing this with their therapist, with their counselor, with their clinical psychologist, or with their psychiatrist.
Wow. Okay. That is fascinating. So then, if I've got this correct, the psychedelic assisted therapy is a way of creating not a blank canvas, but a platform off of which the person can then do the work that's necessary to improve their mental well-being. It's not a cure, as in I'm struggling with depression. If I take this, go and take this hit of ketamine, or if I have this ketamine infusion, then all my problems are going to be solved and I'm going to be happy as Larry after that. You still have to go and do the work after that. Am I understanding correctly?
That's 100% correct. So I guess, as I said, from the get-go, there needs to be sort of a therapeutic rapport that's built with every single person that's part of the team, ranging from the psychiatrists to the anesthetist that's running the infusions, to the therapist that they're now integrating with afterwards. So there needs to be that trust that's built over time, and so it's a whole process. And in terms of psychedelics, we love to use the word journey. It's still you still trip. I mean, patients still come to to my rooms and they sit in a comfy chair, and when I run the infusion, they have a trip. But we like to call the process a journey, because it really is a something that you have to start understanding as a process. And the journey may be difficult. At some places of the journey, you may go super slow. Other times, you may be able to speed up a little bit. But you start learning how to sort of ebb and flow with your mind, come to certain acceptances a lot easier. But that, again, all takes a lot of time. So again, the real what's the word? The real juice of it, the real meat of the whole journey occurs with the therapy component with your counselor, and then also how are you now integrating what you're learning, integrating what you are attempting, or where your intentions lie. How are you integrating that into your everyday life? Okay, so how when when you're sitting back at home and you're sitting quiet, and how is your DMN now activated, and how are we actually within ourselves making efforts to start to rewire that process a little bit? And again, it's a very our brains are wonderfully complicated, and our minds are even more so. And I don't think we're ever going to fully understand, entirely how this actually works. But the bottom line is that it's exciting to feel sort of this fresh air of potential once again, as a person that's been stuck in a rut for so long. And it helps with a little bit of motivation to now start doing that hard work.
Yeah. What does a typical psychedelic assisted therapy session look like from start to finish? So I walk through the doors of Intrinsic Pathways. Talk me through what happens.
Okay, so we're going to talk about ketamine here because that's what we do here. So the reason why we use ketamine in the first place is that it is only one of two legal psychedelics here in South Africa. All right. The other one is it's a Schedule 6 medication. It is mostly used in research purposes. It's also highly cardiotoxic. Ketamine is much more predictable. It is generally wonderfully safe. Obviously, given within the strict parameters that we're trained to use it, and obviously requires certain monitoring. So just to give you the reason why we use ketamine here. So how typically a patient will be referred from a psychiatrist. All right. These are patients usually with treatment-resistant depression, okay, and then anxiety and anxiety-related disorders, PTSD, substance abuse disorders, eating disorders, burnout, chronic stress disorders. The list is growing. So usually they'll be referred from a psychiatrist, having sort of hit a brick wall. They'll then come to me, and we'll have to do a medical screening. I need to determine pretty much the patient's physiological condition. I need to know that the patient is healthy enough to be able to tolerate these infusions. Okay, and if there are any medical concerns that I need to address, then I will then help to address those. Okay, so that when we do start the infusions, we're in a safe space to do so. We will also need to then build a trust and a rapport with a therapist. Okay, so the patient will also have to go for some sort of psychological evaluation. And this may require a few sessions because, again, as I said, the patient needs to start learning how to be comfortable with that specific therapist because they'll be integrating with that therapist after every single ketamine infusion. So we'll put together a program for this patient, and usually the program lasts between 3 to 6 weeks. We put together a program of 6 infusions. Typically, we'll do them twice a week. But I have also found that certain patients have wonderful benefit with doing it once a week. And again, as stated, after every single infusion that they'll do with me, they'll book an integration psychology session with their therapist. So when the patient comes in for their first infusion, they would have seen through all of this. I would have given them a bunch of homework to do, but it's more a preparation. Okay. When we start opening the doors of your mind, we want to have the best possible potential of making sure that the right energy is present. Okay. And this comes with some sort of mental preparation. Comes with something that we call intention setting. So that's a very common topic that we talk about in the psychedelic sphere, is that the patient needs to have started thinking about what are my intentions, but what is it that I am seeking? Where is it that I'm lacking? Something very specific, and we need to be as specific as possible. What can I work on? What would I like to work on? How would I like to see myself when this whole process is done? And we start sort of a mindfulness process of patients actively engaging and consciously engaging with their minds in terms of what is it that I'm looking for. So all this preparation would have taken place before we start the first infusion. I like to sort of have a little bit of a sort of a pre-briefing, and then afterwards a bit of a debriefing session with my patients too, just to sort of make sure that that rapport is built. But we'll get the patient into a very comfortable chair, a nice recliner chair. It's typical. I've got all the monitors set up, so we check their blood pressure, their saturation, and an ECG just to check their cardiac activity. And so they're hooked up to all these monitors throughout, and we're monitoring them through the whole process. We then put an eye mask on the patient and a set of really nice noise-canceling headphones, and we play really relaxing, spacious, sort of atmospheric type of music, all right, to sort of complement the experience. And the experience is very internal, okay? The reason why we block out all these senses is that we want the patients to be able to internalize, okay, to be able to reach inside and not be distracted by other things around us that it's very easy to distract us. So we'll start the infusion. A typical infusion lasts about 40 to 45 minutes, but it's strange when you're in that space and when you're under, sense of time is completely warped. So for some patients, they'll tell me that, oh my gosh, that was so quick. Other patients will tell me they felt like they were under for a lifetime. But typically 45 minutes does the trick. And like I said, I'm sitting with them the entire time. I am monitoring them through the whole thing, making sure that their vital signs are stable throughout. And my anesthetic background, I'm able to address any complications that may arise. So the entire session, all in all, usually lasts about an hour and 10 minutes, because there's sort of a coming out of the experience phase where they're just gently coming back to reality. And it's very difficult to predict what the experience would be. With my first-time patients that have never undergone any type of psychedelic experience, any sort of psychoactive drugs or anything of that sort of thing, we go as gentle as possible. Okay, so we start in a much lower dosage, something just to sort of start getting them comfortable with the entire process. And we can never predict what their experience is going to be. It may be something that is very difficult for them to process. It may be very emotional. It may just be really happy and very gentle and pleasant. Okay, it all depends on how that patient's DMN, default mode network, is sort of rigged in their minds. Patients with anxiety specifically, they like to be in control of all situations through life, and this seems to be a core part of their anxiety. And it takes time to learn how to let go when you're under a ketamine infusion. And so the first infusion will just be very relaxed, very chilled. Like I said, on the lower end of the dosages, something just to sort of kind of give them a sort of a taste, or testing the waters kind of thing. And then as we go with repeated infusions over the course of the next few weeks, we'll start ramping up the dosages, and they'll sort of start getting deeper and deeper into those parts of the mind. But yeah, when they're done here, we just monitor them for a little bit. They're generally able to walk out of here within an hour of having the infusions. We like them to have somebody accompany them and to drive them home. We say absolutely no driving home themselves. And within 72 hours, they would have needed to go and see their therapist. And then it's repeat. Okay.
Okay. Tell me, chatting to people who have engaged in psychedelic drugs in a not so formal capacity, you get good trips and you get bad trips. So, what if, for example, you have a patient who is particularly anxious and is going through a really unpleasant experience, even though the dosage might be low and it might be monitored? Is there a way that you can alleviate those symptoms or bring a person out of that psychedelic state if it is clearly something that is bothering them in the moment?
Yeah. So the the key strength of running an IV infusion is that we have full control over the entire process. All right. In terms of running a ketamine infusion, we can titrate to the minute, sort of how much the patient is receiving at any given point of time. So
Wow.
we'll calculate an entire dosage. We'll put it in, a bag of fluid, and only by the end of the infusion will they have received the entire dosage. And the wonderful thing about this is that at any point of the infusion, if the patient feels like this is too much, this is too overwhelming, they're having a bad trip, the option is always there to get off the train. And I think that is really a wonderful thing about it. As opposed to other classical psychedelics, psilocybin or magic mushrooms, they have to ingest it, and then we have to wait now 6 hours for it to be metabolized through your system. And once you're on that train, there's no getting off.
There's no getting off,
So,
yeah.
so this is a really nice, gentle, and easy and safe way to start sort of experiencing psychedelic medicine without having to go full blown. I like to think of this as a nice introduction to those other modalities. Another thing, I will sort of kind of coach the patients a little bit beforehand. That firstly, that they need to realize that they're looked after the entire time. Okay? There's always somebody monitoring and in the room with them at any given point of time, and all they have to do is say hello, Dr. Kris, help, whatever the case is. All they have to do is vocalize a little bit, and they can get my attention for me to come and address whatever their concerns are. And it's very important for them to feel that element of safety with that. And then there's also grounding techniques. So I always tell my patients that, if you feel that you're now sort of deep in the psychedelic experience and there's an element of dissociation, which is an out of body experience, which patients may enjoy, but often other patients get highly anxious over, all right, because it's, again, a loss of control. There are grounding techniques that one can deploy to sort of help them to realize that they're safe, that their reality is that they're just chilling in a lovely recliner chair. They can grab the sides of the chair just to feel that. I've seen patients, because I'll tell them, just use your tactile sensations. They'll feel your body, they'll feel their bodies just to sort of remember that they still have one. They'll feel their face and feel their nose, but it sort of just brings them back to reality just for a second to sort of calm their nerves and just to realize that things are okay. So there are these little grounding techniques. But by far the biggest strength is the fact that we have full control and titratability of the infusion itself. And generally the infusion will last 45 minutes, but 20 minutes in, if the patient is not agreeing with it, then we can always just cut it short and try another time until they feel more ready, or until the right preparation has been done to try again.
Yeah, fascinating, man. I agree with you in the sense that these psychedelic modalities are becoming more and more mainstream and more research is being done. But sticking with the sort of the informal sector of these psychedelic experiences, there's a lot of psychedelic retreats as they would be called, sort of unregulated psychedelic retreats. And those are becoming more and more popular, particularly amongst creatives and people who are wanting to do it for breakthroughs and that sort of thing. What do you have to say about the potential risks, perhaps, of those unregulated psychedelic retreats as opposed to something that is obviously a lot more regulated and legal, such as the practice that you have?
Yeah. So listen, we have to remember that these substances, whether it's mushrooms, whether it's peyote, with the mescaline, whether it's ayahuasca, these practices have been going on for hundreds, if not thousands, of years, within certain cultural frameworks. And I do have to show a little bit of respect to these cultural practices because it is part of certain people's cultures. And there's a reason why these practices have been done for hundreds of years, because over multiple generations, people have found profound benefit in these psychedelic experiences. Legally speaking, I can't condone this kind of practice. I can't condone these things, but that's not saying that there isn't benefit towards it. As a clinician, as somebody that has been trained in Western medicine, it's very easy to get, sort of absorbed into Western medicine as the only right way. And so then we start looking at these other types of practices as illicit, illegal, as wrong, essentially. And I'd like to see us as a medical fraternity start becoming a little bit more open-minded towards these modalities, but at the same time, bigger than that is that I would love to see more research done into these specific substances so that we could have some objective evidence, and we can practice evidence-based sort of sessions or retreats, without just word of mouth or passing down generations. So it's very easy as a Western practitioner to say no, that is wrong, and to sort of just not give it the credit that it deserves. The bottom line, though, is that these medications need to be treated with monumental respect. All right, and they will all have some sort of physiological effect on the body, as well as a mental or psychedelic effect on the brain. And if we are not careful and we haven't done proper screening, if we haven't done certain preparation to make sure that the patient is in as fit of a state as possible, both mentally and physically, then we can run into issues. So a lot of these substances, for instance, will cause an increase in cardiac output, and how that translates is an increase in blood pressure and your heart rate. All right. So patients may start getting palpitations, their blood pressure may spike. And if a patient with uncontrolled blood pressure that hasn't gone through proper screening processes and is not on medication for that blood pressure, if they decide to undertake one of these retreats and their blood pressure spikes, they're putting themselves at risk for some sort of medical event, whether that be a heart attack, whether that be a stroke. So this is the thing, is that we want this to be regulated, not to disprove these cultural practices and not to get rid of them. Okay, we would love for one day to incorporate all of it into our practice. However, we need to practice safely, bottom line. And the 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 thing is, I guess, with ketamine is that there's been a lot of research. It's one of the most researched substances over the course of the last 30 years. And again, clinicians like myself, anesthetists that are very comfortable working with this anesthetic drug and know how to counter certain effects. And with all the monitoring that we have on board, it's much safer to be able to undergo something that is regulated rather than something that is unregulated. And I've also heard of, for instance, forest retreats. And as wonderful as it sounds, as mind-bending as it sounds, and as beneficial or beautiful as it sounds, um, there's absolutely no monitoring taking place. And physiologically, we can't be sure what's happening with that patient. Okay. You know what? I've read a lot about ayahuasca, for instance. And with ayahuasca, there's a purging that takes place that they talk about. And purging is essentially just sweating profusely, and there can be a lot of vomiting taking place as well. Now, if the patient is vomiting and they're even in a slightly sedated state, that can put them at risk of something called aspiration. And that can have detrimental effects on the patient's lungs, that can send them to ICU. And when I talk about this, this is not to deter people or patients from choosing. Okay, fully believe in autonomy. Patients have the right to choose, but they need to be aware of the risks involved. And sometimes I wonder whether the people overseeing these rituals, whether they are adequately prepared to deal with the physiological um, consequences that may occur.
Yeah, I think well said. Well said, Dr. Goodwin. Tell me about, you spoke about researching. What are the major gaps in the research at the moment that you would like to see more readily undertaken before psychedelics and the range of psychedelics expand into something a bit more mainstream?
Sure. Okay. Listen, psychedelics have been quite difficult for researchers to to really get meaningful information from for a number of reasons. I mean, we all know how psychedelics have been deemed illicit and illegal, since the 70s when President Nixon in the States declared his war on drugs,
Mm,
and psychedelics were sort of umbrellaed under that as well. The only reason why ketamine got away was because it was an anesthetic agent, and so we're far behind in terms of research. A lot of these drugs were invented or created back in the 60s, and had that war on drugs not taken place, we would probably be much further ahead in terms of having the evidence that we need to know exactly what is what in this space. So we're kind of playing this catch-up game. At the same time, the quality of the research that we're able to do is very tricky. And when I say that is, if you know anything about research, the best type of study that Western medicine likes is something called a randomized control study with peer review. And essentially, that is having two groups of people, one giving the active ingredient, giving the other group a placebo, and comparing results. Now, it's very difficult to give a highly psychoactive agent to a group of people and not have them realize whether they're taking the active ingredient or the
the
active agent
psychedelic. Yeah.
or the placebo. And I think you'd kind of know if you took the
Yeah.
placebo or not. So interpreting these results are very tricky. So like I said, that those are the type of trials that doctors want to see. those are the type of trials that prove something has efficacy. Short of that, we start having a bit of start having doubts in terms of interpreting results of the clinical trials. So it's a very difficult type of thing to research and to get concrete evidence about. Everything that MAPS is doing is absolutely incredible. They have shown, at least to a degree, or to a large degree, how beneficial these substances are within the right framework, obviously. But again, there are a large amount of clinicians, practitioners, and doctors that will still doubt the evidence that MAPS is producing, just simply because they don't think that those trials were high quality enough, or there were gaps in the trials themselves for certain reasons. If you had to Google MAPS psychedelics, you'd see
Yes.
it is a lovely website showing a lot of research about many different psychedelics that are happening, specifically in America, and showing, I can't say concrete evidence, but at least showing their interpreted results of their trials, and it's really incredibly fascinating to read about how patients have responded within these trials, and hopefully, trials are just trials. This doesn't legalize anything. They still have to go through ethics approval and all sorts of things, and then obviously they need to go through the other respective boards, FDA for us in South Africa, it's SAPRA, before they can be officially legalized. But these studies and this research is taking place, and it is available to the public for them to see. So it's an exciting space, and the research is happening. But like I said, we're just sort of playing catch up. And now, after 30 years of imprinting in our brains that substances like LSD and MDMA, are highly addictive, dangerous drugs, it's very difficult to now start unwinding those narratives to say that, well, actually, there may be a place for it in Western medicine.
Yeah, fascinating, man. Tell me about you spoke about results and how they are making public certain results that they've come across. What about some results more specifically in your practice? Are there any anonymous case studies that you can perhaps share with me? Some success stories?
Listen, this is the reason why I have persisted with this, is that as a clinician, it's been incredibly rewarding for me to see patients that have been really borderline suicidal, and within the space of 3 to 6 weeks, to see sort of a sparkle in their eyes and to show some hope. And I only get to see them every now and again, just for that 1.5 hours, once or twice a week. It's the therapists, the psychiatrists, and the psychologists that really get to see the meaningful change. But it's really been wonderful for me to see patients that have looked at me and told me that they just feel like they have absolutely no hope, to now look at me dead in the eye and thank me. And I hate taking credit for anything. If anybody knows me personally, they know that I absolutely hate compliments. I mean, that's my own mental health journey stuff to go through, that I'm working on. But to be part of the process is extremely rewarding. And as I said, it's the patients themselves that deserve the credit, because they are the ones that are putting themselves through all the hard paces. They are the ones that are stretching themselves, that are stretching their minds, that are putting themselves in uncomfortable circumstances, whether it be in my chair or whether it be talking about their trauma when they were a child with their therapist. You know, they are they are putting themselves in positions, and they are now more readily um, able to do so and get the breakthrough that they've been looking for, just simply because they've had a little bit of a boost in terms of opening up their mental capacity. Um, you know, there's a number of patients that come to mind, but it's really, you know, patients from, you know, the depression aspect, patients with OCD that can now, you know, function. They feel like they can actually function normally, and their anxiety is not controlling them, you know, constantly throughout the day. Patients that have simply wanted to stop smoking, and they've looked at me and they said, like, without this kind of process, um, they just would have never been able to feel like they were capable of it. The bottom line is that it's not the drug, it's not the medication, it's the willingness of the patient. This is just sort of like a little bit of a boost, a little bit of a nudge, a little bit of a listen, it's safe to do so. So within that framework, we've really seen some really wonderful stories.
Oh, that's fantastic, man. And kudos to you for the role that you are playing in that and in those people's lives. What about people who are not necessarily suffering from any mental illness or poor mental well-being, trauma, PTSD? What about people who are wanting to look at this sort of experience from a self-development and a self-discovery point of view? Is there a place for something like that, or is this strictly for people who are looking to resolve past traumas or overcome mental illness?
Sure. So answering that question may get me into a little bit of trouble. No, no, no. When I say that, I mean we are still regulating the space,
Mm.
and you know, there's a little bit of, I don't want to say a turf war, but there is kind of this friction between practitioners like myself and psychiatrists who feel that they should have the overwhelmingly sole right to be able to prescribe ketamine as a course, you know, as a course. Now, the reason why psychiatrists would prescribe that is because they have psychiatric patients that are struggling with all these different circumstances and different diagnoses based on their DSM criteria. And part of me wonders, why do we have to wait until a patient is absolutely treatment resistant before they are eligible to be able to undergo this process? Now, I live in Joburg. Life is stressful up here, guy. You know, I just remember when I lived in Durban, things were much more relaxed. But you know, just when you're living in a city life, when you have, you know, a lot of financial responsibility because this is how the system has worked. You know, you're paying off car repayments and bonds, and you know, you have to save up money for that goal, and you have to look after your family, and things mount up, and burnout is becoming far more common. And not just burnout, mental issues, whether it is low key depression, whether it is full blown depression, is becoming far more diagnosed in the last 20 years than ever before. And whether the patient, whether the public and we can call them patients, or we can just call them people, are struggling, and they have a specific diagnosis that is attached to them based on a DSM criteria that comes from the psychiatrist's handbook. I personally would love to see, in future, regular people struggling with burnout, struggling with regulating their emotions without a specific diagnosis, be able to come and benefit from something of this sort. Again, there needs to be very, very strong, even strict protocols in place. They need to be part of the process where they still have to go for their therapy, et cetera, et cetera. But I'd love to be able to see the space opening up to more and more people that are not specifically diagnosed with ABC, which are the admitting criteria. Just because of as a person, as a human, I know how difficult life can be sometimes, and something like this could really help patients, people, with their motivation, with managing their anxiety, with managing their burnout, in a much more productive and sensible way, as opposed to, and I see this a lot in Joburg, running to for after work drinks every Saturday, instead of running to substances like alcohol, which is far more addictive than any psychedelic. If we can create a healthy space, then I really think that there is place for it going forward. But as I said, it's a bit of a sticky space, considering how the psychiatrists feel about it at this point of time. What I can say, which is really exciting, is that in the last year and a half, I can't say we, but I'm part of the organization. And an organization has been built called SIPSA. SIPSA stands for the Society of Interventional Practitioners of South Africa. And this is a multidisciplinary organization that is trying to regulate the psychedelic space and wellness space. And it's everybody from psychiatrists to GPs to anesthetists to psychologists, occupational therapists, physiotherapists, anybody that has sort of any type of interest in wellness is welcome to now join this organization. But the point of the organization is to be able to promote this type of conversation between the disciplines so that we can find a common ground and so that we can regulate the space safely. So one of the first goals that we're doing, and I've been asked to be part of, is to now write up protocols for ketamine infusions. And this goes, from everything in terms of indications, contraindications, how to administer it safely, the monitoring that's required, the level of expertise that is required from the practitioner, and then everything that comes with it as part of the integration process as well. And so this can be formalized, and these are now guidelines that can then be implemented on a national basis. So the organization is still very young, but the point is that it's created and it's there, and the conversations are taking place amongst the key role players as to how we can now develop this space in as safe a way as possible and help as many people as possible. So we're getting there. At the moment, like I said, sticky space, tricky question, but I'm really hoping that 5-10 years from now, we can now start seeing this as a much more mainstream modality of treatment that is available. And it's not for recreational purposes. It's not for people that just want to come and have a great trip,
Mm.
It's really with intent and with purpose, um, and with those sort of strict guidelines in place.
Yeah, and more power to you and the rest of the guys who are pioneers at the forefront of this developing research and society in South Africa. Final question, Kris, before I let you go. I don't think it would be a controversial statement to say that, especially with regards to what we've seen in the West, the overprescription of things like anti-anxiety and antidepressants, um, and how that's been abused in many respects and overprescribed. Do you think that there's that risk in psychedelic treatments as those become more and more mainstream that we might find ourselves making the same mistake?
There's definitely the danger of that. So it's definitely something that we need to be consciously aware of. And we need to sort of understand and be very sensitive in terms of the direction that we're going, and sort of have people, and this is also why it's great to have a sort of a multidisciplinary approach, because you have many different perspectives, keeping us on the track that we envision, and that is to do this safely and responsibly. And yes, of course, there's definitely a risk of now sort of overprescribing this or whatever the case may be. The thing is, though, as I said, there's been an increasing number of people over the last 20 years being diagnosed with depression and anxiety and the like. And there's definitely a role to play in now treating more and more people. And that's not to say that no, that I mean, that does not say that antidepressants don't have a space or don't have a place. If I say that they're being overprescribed, um, there's still definitely a role and a purpose. And even when my patients come in for a ketamine infusion, I still very much tell them to stay on the antidepressant. And if they would like to wean off of it, then they do that under the strict guidance of their psychiatrist. But the thing is that we have to be able to hold ourselves accountable, and we need to have multiple role players involved to hold ourselves accountable. And this is where SIPSA comes into play. And being an organization that can then hopefully in a few years' time carry some weight in terms of our opinion on the space. We're not very well respected by the psychiatrists just yet. But as I said, as we grow in the space and as we show our intent and how responsible we want to be in the space, then hopefully we can start all acting a bit more responsibly around around any psychoactive agent. Whether it be antidepressants, antipsychotics, psychedelics, anything that involves treating a patient with mental health. It's going to be key to be able to work on this together, with every single layer of practitioner involved in having a say, so that we can adequately um, you know put down regulations in place that will help to guide future practice. So that's the
Yeah.
goal.
Kris, this has been a thought-provoking conversation to say the least. Where can people find you if they want to get in touch? Perhaps if you've got any social media handles or a website where we can direct people if they'd like to keep an eye on what's happening there at Intrinsic Pathways. And maybe for those of you who are listening who are going through unfortunate issues with mental wellness and they'd like to get in touch to make those breakthroughs, where can they find you?
So my practice is based in Parkwood in Joburg. Um, we're still a very, very small practice now. I kind of like it that way because it allows me to be a little bit more personal with the patient. And like I said, that rapport built is extremely important in the process. Um, but we do have plans at least creating more space and more capacity here in the practice. We can start seeing at least more patients on a daily basis. I have an Instagram handle, Intrinsic Pathways. All right. So you can just type that into your Instagram. Facebook is linked. The website is coming up very, very soon, imminently. So again, you can just type in www.intrinsicpathways.co.za. That's going to be full of information, both research related, secondly, what we do here at this practice, services that we offer. What's wonderful is that here at the center where I work is that we have a bunch of psychologists already on premises. So we are really, really dedicated in managing this as holistically as possible. So yeah, give us a shout. I think our phone number, WhatsApp is on the Instagram as well. So you can just pop us a WhatsApp, and we'll be happy to explain the process, costs involved, how to go forward with it. Really very, very simple approach.
I'll be sure to attach all of those links in the show notes. And I'm going to finish off with a compliment. Kris, well done on all the work that you've done so far. It's not easy being a pioneer and being at the forefront of a new trend, especially when it's in something as important as medicine. So thank you for the tremendous work that you're doing so far and having the courage to put yourself out there and to be part of the change that we are all hoping, at least I'm certainly hoping, to see it become more mainstream. So well done to you, and thanks again for your time.
Thank you for having me on the show. It's been a real pleasure. Thanks.
Thanks. Hey everyone. A huge amount of work and effort goes into producing this podcast, whether it's from the research going into the episode, whether it's finding the guests coming to the location or them being online, to producing the content, edited and putting it in a format that is conducive to your ears and your eyes. And it goes a really, really long way if you can just do me one thing in return for this free content: share it. Share it far and wide, and if you find an episode useful, send it to someone who might feel the same way. That's all. Thanks a million. See you next week.